CataractCoach.com. Help me go from good to great. So an experienced surgeon asked the Cataract Coach fans, that's you, for some help, some advice. Let's watch a case here. Routine case. We made it at 2x normal speed. So good draping, I like that. Nice dilation, good red reflex. There's a paracentesis, that looks okay. Here comes another paracentesis, so maybe for a bimanual IA. I'm watching the case for the first time with you. Maybe some anesthetic going inside the eye. So far, so good. Here comes probably the viscoelastic. Yep, there we go. Viscoelastic filling up the AC. And maybe soft shell technique, maybe a little extra. And let's see the incision here. That's an important thing. Nice, easy in and out incision. Looks pretty good. Let's see the rhexis. I like the incision to hit the limbal vessels just a little bit more than that. So there's a tiny bit of bleeding. It'll seal it better, but the incision's fine. So here comes the rhexis using just the forceps. I like these very long and thin forceps. Good pivoting technique in the incision. Really good, actually. Beautiful. Lysoc and rhexis, not a baby rhexis. And forceps are not marked, so hard to tell exactly, but that looks beautiful. Again, this is an experienced surgeon. Let's see the hydrodissection now. So there's a little bit of fluid wave. Let's see. Yep, there's the nucleus coming up. Now, I like to get the nucleus out of the bag, especially in a case like this where it's just not that dense. And so more hydrodissection. Pushing it back in the bag again. And then let's see the nucleofractus technique here. Phaco probe going inside the eye. Looks like bevel up. Cleaning up, aspirating some of that material there, that anterior lens cortical material. And let's see what we do for nucleofractus. Chopper going in, looks like a Nagahara-style chopper. And buzzing the probe in. And horizontal chop, cleanly done. Good propagation, splitting those two halves, rotating. And then probe goes in again. Let's take a look. And another chop. Excellent technique here. Very nicely done. Taking out one quadrant. So again, a relatively soft nucleus. Little bit of chamber bounce there if you watch as this piece comes down. This piece comes down. Now look at the cortex. After the piece is clear, there's a little bit of a bounce there on the iris and the capsule. So maybe increase your infusion pressure a little bit. Beautiful chop again. Incredible technique. I mean, you're a very talented surgeon. There's no question. So to be more efficient, I think you're doing things right. So I wouldn't worry just yet. Everything here looks fantastic. And then here's the last piece of the nucleus. Let's see this chopper go in the safe position, protect that capsule. Piece comes down. And let's see, is there a little bounce in the AC? Not too bad, actually, a little bit. So that looks very clean, very nicely done. And let's see the cortical material removal. There's that last piece. All righty. Now, with a soft lens like this, you can be a lot more efficient. If you are just doing a flip and chop technique or tilt and tumble, that'll actually make it a lot faster. But your chop technique is clean. It's pretty, very nicely done. All the chops were executed very nicely. No issues at all there. Now switching over for cortex cleanup. Let's see. Again, I'm guessing it's going to be bimanual. Yep, there we go. It's going to be bimanual setup here. Looks like the infusion in the left hand and the aspirator here in the right hand. Maybe make that second para, the one that's right there for the right hand, maybe make it a little farther away. It's a little, to me, it's a little too close to the main incision. But again, that's not going to make your surgery more efficient. I'd rather have these paras a little bit farther apart, a little closer to 180. Right now, they're probably like 110 degrees apart. So, and again, that second para is a little too close to the main incision for me. But again, it works fine. So cortical removal here. And another thing you can do to make this more efficient is the cortical removal, try do it in more of a circumferential manner instead of just radial pulling of it. So if you do that circumferential manner, you'll be able to grab larger sheets of cortex at the same time instead of grabbing just little strips. So a few little pieces taken away there and aspirating down. There's another little strip of cortex. So again, you're stripping on the cortex is strip by strip is a little slow. So I'd tell you, try to do it more tangential and not just radial every time, because all you're doing is pulling away little strand by little strand, whereas you should be able to grab at least 2, 3, even 4 clock hours of cortex at a time to pull it. So that's better. That's about a clock hour of cortex. And again, stay circumferential. Yeah, don't pull radial yet. I just stay circumferential throughout, and you'll be able to get it aspirated very quickly. So cortical removal here, I think, was beautiful. Went very cleanly, nice 360 cleanup, but it's a little slow because a lot of radial pulling. Did I tell you about CataractCoach.com, our teaching website? Come on now, people. I say at the beginning of every video, right? CataractCoach.com. You got to check it out. There's a free PDF book about learning surgery. There's a whole series, by the way, about how to become more efficient. You don't know if you don't check it out. So here comes the lens being placed in the capsular bag. That goes in beautifully. Get that lens positioned around a bit. Looks great. I mean, I like this technique a lot. Look at that rexus overlap. Beautiful. Very nice. And now here to remove some, okay, seal up the main incision. I like that idea, especially if you're going to do bimanual now to remove the viscoelastic. So here we go, remove viscoelastic, hopefully going behind that optic as well. There you go, lifting it up, beautifully done. I like the aspirator and the infusion underneath that optic to really wash out any retained viscoelastic. That looks fantastic. Beautiful. Again, that's a great rexus, great. This is a beautiful case. I really don't have any criticism for you in this case. You've done a beautiful job. My only advice is, the hydration. That's a bit much on the hydration because that can cause some astigmatism the next day and the patients won't see quite as well. It takes them a couple of days for that hydration to go away. But again, beautiful technique. My advice here is just fixing that cortical cleanup. And if it's a soft nucleus like this, you want to be a little more efficient, trying a tilt and tumble technique or flip and chop technique, getting it out of the bag. You'll probably be able to aspirate the nucleus a lot quicker. But you're a fantastic surgeon. And I look forward to reading the comments from our viewers down below. So please leave a comment below. And remember, check out our Cataract Coach podcast every single week. Beautiful podcast, amazing guests, and follow me on social media.